Hello and welcome to Health Live at Seniors today. We are delighted to have here once again Dr. Pratit Samdani. And Dr. Samdani, as you are aware, will answer questions on the COVID vaccine, the need to take the vaccine, space between the first and second dose, the aftercare, and all the questions that you may have wanted to ask. A little about Dr. Samdani. He is an award-winning doctor with specialization in internal medicine. He has experience in general medicine, emergency, casualty, HIV, isotope, diabetes, nephrology, neurology, infectious diseases, and OPD. He has vast experience in training and teaching graduate and postgraduate students. He is an honorary professor of medicine and head of medicine unit at the GT and Sir JJ Hospitals in Mumbai. He's a consulting physician, intensivist, and head of the Department of Intensive Care at the Beach Candy Hospital. He's also a consultant physician at the Jaslok, Saifee and Bhatia Hospitals in Mumbai. Welcome to Health Live, Dr. Samdani.
Thank you so much, Mr. Maheshwari. Pleasure to be back again.
How's it been since the last time you were here? The vaccine has happened. Have you taken both your doses? Have you taken one of your doses?
So yes, the vaccine has happened, but the vaccine of the infection happened for a bit, but it's again on the surge. So I have taken both my doses and I'm well 3 weeks after both my doses, and we can speak about the protection it gives in the next 1 hour.
And which vaccine did you get? The Covishield or the
I have taken the viral vector platform vaccine, which is the Covishield vaccine.
And no, I'm asking you this question just also too because of the kind of question that have come in. And did you have a choice in terms of the vaccination that you take, or you just took whichever vaccine was available at that time?
So as a frontline worker and healthcare worker, we were first asked to get vaccinated. And that moment, we only had Covishield available. But when my turn came for the next one, we had both available. So it's not that I just took this out of no availability of the second, but I didn't think it was a bad choice.
Right. And you had no side effects and all those things that people are worried about.
Well, vaccines like a marriage. Most of it is fun and loving, but there are, of course, ups and downs. So these ups and downs are temporarily most of the time. So a day or two of some body ache and some muscle pain is evident. I mean, we've had it as children. We've seen our children have it as parents. So nothing unusual at all.
It's interesting that you talk about the fact that as children, people get vaccinated. Now, when I remember getting vaccinated, of course, I don't have, many memories of my childhood, but when I was getting my daughter vaccinated and the multiple times, I never really worried about, I wasn't worried about the after effects. I wasn't even aware of who's manufacturing it. Right? But now, all those questions are coming. Is this right? Is this wrong? And is that something that you think is a valid sentiment that people have?
Let's go to evolution of things. When we were children, or when our children were vaccinated, presuming your children were really small when they were initially vaccinated in the pediatric age group, we didn't have so much data. We were not vaccinating or getting vaccinated for a newer disease. And with the advent of technology and television, media, reading, something like Seniors Today, there is much more awareness. So when there is more awareness, there are more noses that are sharper and poking, and thus more questions. So correctly so, we never asked our father or our children or our doctors when we vaccinated our children about the side effects of the manufacturer. But yes, and it's a great thing that you've got it right on the top, because this is usually my closing line, that there is no vaccine for the stupid. If you have vaccinated your children, if you vaccinate your pets, why do you think of or question yourself of getting vaccinated? So,
all right, I have at least 100 questions that have come in, and I was trying to sift the questions, but I'm going to get into a question that has come in from someone, and there are quite a few questions like these. I got myself vaccinated on 1st March. The first jab was on 1st March. When should I take my second jab?
Yes, so this is the dessert before the main meal. And this is the most important question. So let's go to what a vaccine does. So vaccine is essentially a protective thing that fights against a particular disease for which you have been inoculated. Now, and our topic is related to SARS-CoV-2, that's what we're here for. So when you take the shot of your first vaccine, we will go into which vaccine a little later. After 13 to 15 days, your body may start developing some antibodies. Now, what are antibodies? Antibodies are Y-shaped proteins that actually fight against these foreign invaders or this infection when we talk about SARS-CoV-2 that fights against COVID-19 and builds or regulates or upstreams our immune system by doing so. After you take the first shot, it's 13 to 15 days where you start developing some antibodies. These antibodies start peaking, and at the end of around 4 weeks, you will get what we call as the first dose response or the primary immune response. When you take the second dose, and this first dose response is not adequate enough if you've not had COVID in the past. And when I use the word not had COVID in the past, I'm going to divide this into two groups. The COVID naive patients, naive means who've not had COVID in the past or the recent past, and the COVID patients who've had COVID in the past. So for a COVID naive patient, this one dose is not enough. So you need a secondary boost to your immune system, which happens after you take the second dose of the vaccine, which is typically, as we may debate, and I use the word debate because there is no correct answer at the moment, 4 to 8 to 12 weeks after your first shot.
4 to 8 weeks is 4 weeks, right? What is the ideal suggestion?
So let me tell you what I think is the correct thing. So the Western world will be, let's divide the two, and we'll come back to India, because India has really done phenomenal. And I think we'll have better data and better protection and better outcomes than anyone in the world. So let's divide the Western into the US and the UK as in Europe. The US have two vaccines that are available, the Pfizer vaccine and the Moderna vaccine, which are mRNA-based vaccines. So these two vaccines are mRNA-based. Clearly, both of them are to be given at a space of 21 and 28 days from the first shot. So Pfizer is after 3 weeks after your first shot, and the Moderna is 28 days after your first shot. And there's been absolutely no debate about this. When we come to Europe or UK, that's where predominantly we've had the Oxford, AstraZeneca, or the Serum Institute, or the colloquially known Covishield vaccine. The debate has been that you should take the second shot after 4 weeks, probably best at 8 to 12 weeks. Now, my thoughts on this. My personal feeling is, for a person or a patient who's never had COVID, and I again come to the terminology COVID naive patient, it may be late to have an adequate immune response after 8 to 12 weeks. So I think it would be good if one takes the vaccine after 4 weeks. Now, why is this different or a little different for someone who's had COVID-19 in the past? For someone who's had COVID-19 in the past, the infection goes inside your body. And in the body, we have all done a hemogram. We have the hemoglobin and the WBC. The WBC, if you see, have parts: neutrophils, lymphocytes, monocytes, basophils, and eosinophils. Now, we talk about the lymphocytes. There are two types of lymphocytes, and this is not medical jargon. This is very simple. It's called the T lymphocyte and the B lymphocyte. The T lymphocytes are the memory lymphocytes. So the moment you get an infection, whether it's natural or due to inoculation, the T lymphocytes are activated. They have a second helper, which are called the helper T lymphocytes, which actually enthrust some power on the B lymphocytes to produce more and more antibodies. So if you've had infection in the past, your T lymphocytes are already activated. They know that this is a virus or this is my enemy. And the moment it comes to me again, I am ready. They can recognize, they can reshape, they can recall, and they know what kind of war armamentarium they need to fight it. But if you've never had COVID in the past, your secondary immune response will never be adequate, or if I may use the word, exaggerated. Now, from a recent study as soon as last week or maybe 2 days ago in the UK, now this data can only come from healthcare workers because they have been inoculated first. They took about 18,000 healthcare workers and they divided into two groups, forget the groups. And, about 10,000, 9,000 were from UK, about 6,500 from Brazil, and South Africa, another 1,000 or 1,500. Now, when they saw healthcare workers, people who had infection, healthcare workers in the past, their immune response was robust after they took the first vaccine. But this robustness was absent in healthcare workers who never had an infection in the past. So when we call or talk about the vaccine efficacy, within 6 weeks, less than 6 weeks, the efficacy was 55%. When it came to 6 to 8 weeks in this group, it was 58%. 9 to 11 weeks, it was 70%. And after 12 weeks, it was 81%. So my suggestion is that if you've never had COVID in the past, it's almost certain at this point of time, until we get new data, we're talking about a new disease, to take your second shot after 4 weeks or closer to after 4 weeks and not wait for 8 to 12 weeks.
And the facilities where the vaccinations are administered, will they allow you to take it after 4 weeks, or will that need a doctor's recommendation?
Oh, yes, I know the government has just come out with a regulation that it's wiser or maybe more advisable to take it after 8 weeks. But at this moment, I think it's okay. They are allowing people to take after 4 weeks, but this resolution or this advisory has just come in 5 days ago. Let me also tell you, my gut feeling for this 8 to 12 weeks is that so that they can protect a larger population. When I talk about Europe and UK, they wanted to inoculate larger number of people because of the availability of the vaccine, because manufacturing was not right up there. So if you inoculate larger number of people, even with one single dose, they have some protection compared to no protection if you don't inoculate them. I think for a country like India, where probably dosage and vaccination and manufacturing is not a big issue, I would stick to 4 weeks.
Do you advise that before one takes the vaccination, one takes the first shot, one gets an antibody test so that one is aware of what the antibody levels are? Because there are sometimes people who may be asymptomatic and they may have had COVID, but they're not even aware of it. So would you advise that a person takes an antibody test before the vaccination and one after the first shot or the second shot?
Mr. Maheshwari, that's a great question. 60% of the population in the world who've had COVID-2 are mildly symptomatic, or even if you say the younger people are asymptomatic. Is it advisable to do an antibody test? Politically, my answer is no. It's not economically viable. Interpretation, standardization, all needs to be kept in mind by the reader, by the person who's running it, the runner or the laboratory. So it's not advisable. However, if you do want to run your antibodies, there are a couple of types of antibodies. You have your total antibody and you have your IgG antibody. Anything in the past, whether it's a vaccine or an infection, IgG values will be reflective of some amount of protection. Typically, IgG values, and this is not a standard, I'm giving a random number of more than 5 will give you some protection. These are for patients who've had, and your question was clearly for people who probably had an infection in the past, not knowing well that they've had infection in the past. So yes, you may do your antibody, but it's not important or really compulsory to do your antibody. I would say even if you've had your antibody, even if you've had COVID in the past, your first shot should be absolutely mandatory. And there's absolutely no harm in taking the second shot in time. The only issue, if you are morally so responsible and you've had COVID in the past and you know about it, you may delay your second shot because of unavailability or less availability of a vaccine.
There's a question that has come in, and I'm sure this is something that people are saying, is that we were all told about the 28-day space between the two vaccinations. Now it's become 6 to 8, 8 to 12 weeks. Do you think there's too much of a trial and error that is being done? For instance, this whole thing, you may have said it a little casually, but the fact that even doctors aren't aware of what the reality is. So is this the new normal of the fact that nobody's really aware of it? And there could well be, right now, the government has advised a certain space. It could well be different. It could well be 3 weeks. It could well be 15 weeks.
So I wouldn't use the word trial and error. I would use the word optimization of time. Yeah, keeping in mind resources and population both. So it's not really trial and error. It's by the data we have, and the one that I just showed you about healthcare workers from UK. It's great to get vaccinated in 4 weeks. Though in the United States, I would guess by July, September, the entire population eligible will be vaccinated. And there'll be both shots, which is going to be great. So I think there's no trial and error at this moment. 4 weeks is it, and you should take it. You may delay it. There's no harm delaying it. But every time you delay and you don't have an adequate response, there is a higher chance of getting COVID-19.
We have a question from Mr. Harsh Goenka, who asks, if you have good antibodies and one regularly keeps on checking, can one keep on extending the second jab of Covishield to 12 weeks?
Yes. So now I come to a second part. Mr. Goenka is always savvy and keeps reading, so I have to answer him more medically now. I come to the second part of testing. I spoke about total antibodies and IgG. Now I talk about something called as neutralizing antibodies, because he's used the word Covishield here. Now there are two parts of proteins in the COVID-19. One is called the neutralizing antibody, and the second is called the binding protein, or not antibody, neutralizing protein and binding protein. Now, the neutralizing protein binds a particular protein on the virus and prevents the virus from getting inside. The binding protein, which is a more complex protein, does not prevent you from getting infection. So if you've taken the Covishield and if you finish 4 weeks and you'd want to wait because of the obscure data that we have, whether it's 8 or 12 weeks, I would recommend that you may do a neutralizing antibody. And if the neutralizing antibody is well above the limits, and the limits on the report write 20%, but I would say anything more than 60, 70% is decent protection, you may wait. If you have a 90% protection, you're even more eligible to wait for a month or so.
We have received many questions asking this. In fact, I perhaps should have asked you the first thing. Can one get COVID after the vaccination, and what precautions should one take?
Superb. Most important question. COVID-19, as we spoke in the last term also, is here to stay. A vaccine, no vaccine on this earth for any disease gives you 100% protection unless it's eradicated, unless the disease is eradicated. So the COVID vaccines, whether it's Pfizer, Moderna, Covishield, Covaxin, Sinovac, the Zycov, the biological E, the Johnson & Johnson will give you 100% protection. The Pfizer, Moderna give you 90 to 94 to 95% protection up to 2 jabs, 21 to 28 days away. Now, what does this protection mean? This protection means, and this is again in clinical practice, what we are seeing today, and in fact of the literature around the world, will prevent you from severe COVID infection and will prevent you from entering the hospital and the ICU. So it's extremely protective in terms of getting you a severe COVID infection. It's not 100% protective in getting you COVID-19. I have more than a dozen patients who have taken 2 jabs and have had COVID in the past, few of them, and again come back with COVID-19. So it's not going to protect you. And that's not because the antibodies have faded away. We're talking about someone who's had COVID 4 or 5 months ago and taken 2 jabs in the last 1.5, 2 months, and yet has had COVID. So yes, I would call COVID etiquettes or COVID behavior, distancing, hands under the tap, mask above your nose and below your chin should be maintained at all times until we've nearly eradicated this infection or disease.
But maintaining a distance, and given the fact that the government has opened up train services, your cinemas are open, etc., is easier said, isn't it?
In a country with 132 billion population, it's not only easier said, it's impossible. I completely understand that. Now, in this second surge, and we've seen this in the past 100 years ago when we had, or 200 years ago, every 100 years we've had a pandemic. The second wave is always more furious, larger people getting affected, and more morbidity and mortality. If you have larger numbers, and even if the mortality is 1%, the number of people getting affected or dying will be very high, because sheer number of people getting affected. Now, if you, what I see at this moment with this second surge or spike is that people who are in the lower socioeconomic status are actually getting less affected. It's the people who've kept themselves inside their houses, who've correctly protected themselves for the last 1 year, the high rises who are getting more affected. And the reason is, if we were to do an antibody level as a mass for the population, we'll find a large population already having protected antibodies. So I understand that it's difficult to maintain a distance, but at least it's absolutely necessary and important to put your mask up, clean your hands when you get off the train or the buses. That's the best we can do.
A question has just come in on the basis of our conversation. Doctor, do you think it's a good idea to keep taking antibody tests every few weeks to know where one stands?
No. It's like a pundit telling you that you have 100 years to live, and after 1 year it tells you 99 years you have, and then after 5 years you say you have 95 years, but then as your percentage or years drop down, you become more fearful. So I don't think it's a great idea to have to do antibodies. However, if you've taken 2 shots, it may be wise, because we don't know how long this protection will last, to run an antibody test after 6 months if you're not a healthcare worker. For someone who's right in the front, I would do my antibodies at the end of 3 months, because we've seen that, our antibodies, if you don't get repeated infection, our antibodies do fade down, and we need more protective antibodies because we are right in the center of war.
Thanks. We have a question from Aarti Dhawan, who's a patient of yours since 2018. She says, I was told that if we have any infection, then taking the vaccine will aggravate it. I have a constant cough, plus I'm allergic to aspirin and penicillin. Also, my D-dimer and CRP are high. Please advise.
Yes, Mr. Aarti Dhawan, I'm aware. If you do have an ongoing infection, or if you have fever, you may want to wait to take your vaccine, whether it's the first or second shot. But just because your D-dimer is high, see, D-dimer is a non-specific marker. It goes up in several conditions, including inflammatory conditions. Patients who have any kind of inflammation, the D-dimer can go up. But if you have skyrocketing D-dimers, then you need to be investigated. So if you have ongoing infection, you may wait. If you're on aspirin, it's completely safe to take a shot. If you're allergic to aspirin, it's absolutely safe to take a shot. The vaccines that we have no actually chemical material or any chemical medicines inside the vaccine, so it's completely safe. More importantly, they have no preservatives. In the past, you had more allergic reactions to vaccines because they contain preservatives. These have no preservatives.
We have a question from someone who says, I have comorbidities. I'm not yet 60, not checked my sugar and BP for a while. I think my sugar is high. Can I still go ahead and take the vaccination?
Well, yes, you must go ahead, and you should have gone ahead long time ago, yesterday and a month ago, to take your vaccination, because you have some comorbidities. Probably you're assuming or presuming that you have diabetes. Irrespective, 1st April, and it's open to everyone above 45. Even without comorbidities, you must go and take your vaccine.
Yeah, thank you. We have a question from someone who says that, I take I do periodic blood work, like sugar levels, lipids, etc. Now, is there some kind of a regular test that I must do to check my anti-COVID readiness?
So a CRP test, I know where this is stemming from. This is stemming from the word CRP. That's called C-reactive protein. C-reactive protein is an inflammatory marker. It's a marker where you have infection or inflammation, not necessarily infection. I would say it's a faster and a younger brother of ESR, the conventional ESR, where it takes time to rise and time to drop. CRP is early to rise and early to drop. Now, if your CRP is high, then you need to find out if there's some infection going on. Just because your CRP is high, it does not mean you're not a candidate to take your vaccine shot. So just retaining or just saying that your CRP, suppose the normal value is 3, yours is 4, you may find out if there's a reason why it's 4. It could be because of infection, inflammation, cardiac issues. Get that sorted, and then you may go ahead and take your vaccine. It's not imperative to do your lipid profile or check your sugar before you take the vaccines.
Thanks. We have a question from SP Khade. Quite a few questions, but I'm going to ask one. The vaccine is supposed to be stored at a low temperature. How can I be sure that the vaccine administered to me was in the right temperature range?
Believe in thy government, believe in thyself, believe in the state and country you live in. The vaccines of India, Covishield and Covaxin, are easily storable at 2 to 8 degrees. That means a refrigerator. Even a small village today has a refrigerator. So I understand where you're coming from. So you're talking about what we know, what we call as a cold chain supply. That means from the manufacturing unit out of the factory to the recipient area or to the vaccination center. Are you sure that the vaccine is maintained? So I am pretty sure the government has taken absolute cognizance of the fact in the last 6 months that cold chain supply is maintained. If we talk about the Pfizer and the Moderna, they require temperatures of minus 112 to 74 degrees Fahrenheit for the Pfizer and as low as minus 4 degrees Fahrenheit for Moderna. So those two vaccines will be extremely difficult in our country, in our situation, in our temperate kind of climate. But these two vaccines will be well kept and well stored. I may want to add one more line to this. In the year 2019 or 20, 25% of the world's vaccines were actually destroyed because of improper cold chain maintenance. So it's not that, I've got the wrong vaccine. I'm trying to tell you here that there are enough policemen and safeguards to make sure that cold chain is maintained. They are transported with a thermometer. There's a regulation that you need to maintain the temperature and record it every 6 to 12 hours or 24 hours. So it's all going to be maintained. Once the vial is open, it needs to be administered in 35 to 40 minutes. And to get 10 people to get vaccinated in a 10 ml vial, it's absolutely so easy because there are hundreds of them waiting behind. So I am pretty sure that you will be vaccinated with the correct temperature storage and you should not be fearful. India is the largest manufacturer and has the most robust and successful national immunization program. We have eradicated smallpox and now polio. I'm very confident that it will be well stored.
Well, Doctor, we are entering the summer months and we do know that electricity is not 100% available across the country.
So So in places where there is a problem of electricity, these can be stored easily in thermocol boxes with ice packs at 2 to 8 degrees. And there are refrigerated vans that run on battery. And these are called vaccinators or vaccine vans. And I can assure you that they'll be well. If at any moment on checking, the municipality or the government will make sure that that batch of vaccine is discarded if there is any issue.
You just mentioned believe in thy government, but do you think one can really believe in state governments, local governments on this count? Because if they do confess to what happened, then they will be hauled up.
I think this is a national emergency. Every politician and every person working in a municipal office, if it comes down to that level, or a vaccination center or a hospital, is so much aware that we need to vaccinate the entire population eligible for it. And I can assure you that they will do their best and try their best to make sure that everything goes smoothly. Tomorrow it may happen that you find someone or some place, a small place called XYZ, where the temperature was not stored properly. If it comes out in media, be rest assured that it was discarded. That's why it's come out, and they've been honest about it. So I have no fear.
Thanks. We have a question from Shyam Prakash Agarwal, who says, my cousin is sulfur drugs allergic. Can he take the dose?
What allergic is he, Mr. Maheshwari?
Sulfur drugs.
Sulfur. So this has no sulfur. He can absolutely safely take this dose.
There's somebody who says, I'm 55 and high cholesterol, hypertension, liver problems. Can I go and take the vaccination?
Yesterday. Yes, you may go ahead and take the vaccination.
There's somebody, there's Saifee Chandavarkar, who asks, does the mRNA vaccine Covishield provide better protection against mutant variations compared to the accentuated Covaxin? That's one question. The other one is that, is it worthwhile traveling to the US to get a Johnson single vaccine jab?
Wow. So if you see efficacy data-wise, the mRNA vaccines, the Moderna and the Pfizer, have shown protection about 94-95%, vis-a-vis the Covishield or the Covaxin, which shows a protection of 70 to 80% after 2 doses. So in terms of efficacy, they may be more efficacious, but that doesn't mean you pick up your bag and run tomorrow to US and get the shot. I think it makes no sense. 2, the Johnson & Johnson vaccine. So the Johnson & Johnson vaccine, you'll be surprised, or if you're aware, you won't be shocked that the efficacy or the proven efficacy is 66%. It's just 66% lower than what even Covaxin, Covishield, Moderna, or Pfizer has. Now, the Johnson & Johnson vaccine works by what we call using a modified method or a modified adenovirus, which can actually does not cause infection, but goes inside your cells and stimulates your immune system. It stimulates the WBC. So it works similarly. It does not cause infection, of course. Efficacy is 66. It's a DNA non-replicating virus vaccine. I see no great advantage of taking the Johnson & Johnson besides that it's a single shot vaccine, but it also gives you a 66% efficacy. So it's better to take 2 shots, which gives you 90% rather than one of 66.
Thank you. We have a question from Jyoti Udeshi. I am Jyoti Udeshi, patient of doctor. I'm a cancer survivor. Need to flush my port regularly. How many days before and after the jab can I get the port flushed? That's one question. And another person has also asked, saying that my father is doing his chemotherapy. At what stage can I get the vaccination done?
Seniors today has the most elitist crowd and most, intelligent crowd that I've heard today, ever. So excellent questions. In terms of flushing your pot, you can do it immediately. There's no contraindication. In terms of taking your chemotherapy, there's no problem. You can take it between your chemotherapies. But I have a little caveat. When we speak about the Moderna and the Pfizer, the mRNA vaccine, it's advocated that if you're on a drug called rituximab, which is a kind of a chemotherapy, not only use cancer, but other chronic diseases also, it's advisable to take your rituximab at least 4 weeks before you take the shot, or if you have to take the drug, at least keep a gap of 2 weeks, and that's only for rituximab. Otherwise, you can well go ahead and take your vaccine at any moment.
Thanks. We have a question from Mr. Pankaj Garyali, who asked, does one need a booster dose sometime down the line after taking both the shots? Is this going to be a yearly ritual?
Yes, I am in the same boat that you are in. And my gut feeling is, yes, you will need a booster dose at some point of time. And I can't tell you at this moment whether it's going to be 6 months, 8 months, or 1 year down the line. So at this moment, there seems to be that there will be a booster dose, because we see the vaccine is just 4 months old. We don't have data for a year or 2 years or 5 years. And we don't have antibody levels after 6 months and 1 year of people who have taken it. So but my gut is you will need a booster at some point of time.
We have a question from Vishal Sampath, who says, what happens if multiple vaccines of different companies are taken? That is Covishield, Covaxin, or Covaxin plus Moderna, Covishield plus Covaxin. Does it give better protection?
This is a question, Mr. Vishal, that I've asked to myself. and I have generated some answers to this. The mechanism of action is different. So the Indian vaccines, the Covishield and the Covaxin, the Covishield essentially, gets your spike protein, so one single protein. The Covaxin attacks the complex protein, so it attacks the S protein or the spike protein and some other proteins. So I really see no direct advantages in taking back-to-back different vaccines, but I do see a theoretical advantage of taking one vaccine of one type and the second vaccine of a second type, or a booster. That means maybe a third time when you take a vaccine, not the second shot, of a different type. So I do see an advantage. So there are studies ongoing with the Gamaleya, Sputnik, and the Covishield to say the first you take the Covishield 2 vaccines, or you take one of the Gamaleya and take the Covishield next. So as I said, the mechanism of actions are a little different. You not only want spike protein protection, you would also want whole complex protection. But spike protein protection is extremely important. As I explained you, that there are binding proteins and neutralizing proteins, and neutralizing proteins are the ones that prevents the infection. So I would certainly take both of them at the dedicated duration, but I may want to take my booster if I have to, of probably the second type.
Dr. Pardon my asking you this, but what would you do for yourself? Would you, what have you taken now, and would you change your thing in a bit? Did you take this? Was your second jab the same as the first one?
Absolutely. I've taken both Covishields, and I've had extremely minimal side effects, like 99% of people would have. And many of them would have it, and that is expected. And if we speak about that, it's going to be pain at the site of injection, maybe some fever, a little body ache and leg ache. Some people may get a little dizzy for a day or two. Few people get fever for 2-3 days and body ache for 4-5 days. Your left arm, where you typically take it, maybe a little sore for 4-5 days. That's about it. That's the maximum side effect that I've seen. But if I were to take a booster shot 6 months, 1 year down the line, I may shift over to a Covaxin just because of its mechanism of action.
All right. And, there's something you mentioned about people dying after taking a vaccination. And the number of cases is fairly high, someone has said. What is the truth behind this?
Yes. There are 25 lakh people who get flu every day in this country. 25 lakh people. I don't think even 50,000 people are reported of suffering from common flu. Likewise, there are, I don't know the number, maybe 10,000 deaths because of cardiac issues every day. I think it's a matter of coincidence that 5 or 10 people have died after taking their second shot. I mean, they would have naturally died in a car accident or naturally because of a heart attack at same point of time. It's just that if 10 people out of 6 crore people die, I feel there's no statistical difference. If we talk about why EU had not abandoned but halted Covishield, or why the European 7 countries had halted, Germany being the last, they had 7 cases who had cerebral venous thrombosis. That means clotting. Cerebral means brain. So blood clotting in the brain. Now, 7 out of 16 lakh people gives you an incidence of 0.0004. Naturally, the incidence of cerebral venous thrombosis is almost 1.5 per 1 lakh. That means the incidence is 0.002. So the natural incidence of cerebral venous thrombosis is higher than what Germany had reported to say that this vaccine causes it. So I have I don't think there is a statistical significant relationship at this moment of time to say that any of these vaccines cause thrombosis.
There's somebody who said that my friend's father is 70, and he's worried about these side effects of the vaccination. How do I convince him about it? He doesn't want to invite trouble, this person says.
Mr. Samdani, you're going to invite trouble with COVID if you don't inoculate this gentleman. Side effects can be easily managed by taking paracetamol for body ache, fever, and headache, and resting for a day if you want to be super safe for 24 hours to 48 hours after your vaccine. I think it's imperative, especially the elderly population. Let me tell you something more. What I've seen with the people of, with the now large number of people doing the antibody tests, the response to a vaccination is much slower, delayed, and less in elderly people than younger people. And if elderly people get COVID in any which ways, the morbidity and mortality is higher. So I would urge, especially all the seniors and this seniors robust audience, to go and take your vaccine, because the risk of getting COVID and the risk of getting into the ICU, God forbid death, is much higher than anyone dying or getting sick permanently or for a longer duration because of a vaccine.
So there's somebody who says that my daughter is getting married in the next few weeks, and is it okay because she is a frontline worker? Does it impact health in any possible way, especially sexual?
So there, if she has weeks to go, as we discussed, your side effects could last for 48 hours, maybe for 5 days max, and they will gradually diminish. And I can tell you by personal experience, I had some side effects for 24 hours. By the clock, 28 hours stuck, and I was back to normal. So it does not affect your sexual habits, or it doesn't interfere by your sexual behavior, but it's not safe at this moment. And I'm not talking about her. I'm just extending this question or this answer. It's not studied as yet whether pregnant women should take this vaccine today. But if you're getting married in a couple of weeks, go ahead and take your first shot.
There's a question from Shefali Shah, who asks, why did Wish Candy stop Covishield and start Covaxin?
It's only a matter of supplies, to my best knowledge, rather than compulsion or preference over one over the other. It's only because of that. I see no other reason why they have not got their new stock of Covishield. The moment they get their stock of Covishield, I'm sure you'll have a choice which one to take.
Doctor, quite a few people who have asked questions about the life after the first jab. So the overall, your overall views on how freely can a person move around, what kind of liberties can one take in one's lifestyle after the first jab?
Wow. So I will again divide this into two parts. In terms of side effects, free of all side effects, 99.99% within 48 hours. In terms of safety, socializing, working, traveling, intimacy, I would say you have to be careful even after your second jab. It's not that you've taken your first vaccine and you go out and start partying on the trains of Mumbai or on the bars of the country and saying that I've taken my shot, I'm protected. You are not protected to 100%, especially not after the first jab. Even for, say, if you have taken the second jab, you've developed antibodies, not knowing the numbers because you've not done the test, you don't want to be a carrier that single day to someone at home. So I would say, please, let's all behave. This surge at this moment is, as Mr. Maheshwari was saying, the local trains. And I would say equally responsible is the bad behavior of us. We've been misbehaving ourselves, masked down, forgotten our distances, started playing cards, started going to marriages in large numbers, started socializing, inviting people. So we are to be blamed for this too.
Doctor, you mentioned about marriages, and there's somebody who's asked me, says, desperately need an answer for this. I have been invited to a marriage in mid-April. I don't know whether to go for it or not go for it.
If you're invited to a marriage, and if it's not your immediate family, it may be your best friend, I would say if it's not important, do not enter, because mid-April is still where the surge will happen. It's not that you're going to get a plateau or a downward trend. Number one. Number two, if the person who's having the marriage wants to invite maybe 50 people and it's a small affair within a large area, it's still okay or pardonable to do it. I would say it's the responsibility of the person who's organizing the marriage to make sure that people get their COVID test done before they come in. because you may not be a sufferer, but you can be a carrier, and you don't want this event to be a super spreader event.
Thanks. Doctor, there's a question which is not vaccine related, but just general care is, Doctor, if I want to have some people coming over for a dinner or a drink, what is the kind of precaution levels that I must maintain? How do I find out whether the person could be a carrier? And how do you, it's impossible to be wearing a mask all the while sitting at home.
You can't find out if a person is a carrier. But I can tell you, if the person is a little senior, is little elderly, is more than 60, the chance of being a carrier and not getting affected is much less. So he will get affected. If not today, maybe in 2 or 3 days. So you will come to know. If you have to call people home, I would suggest do not call too many people home. Restrict your number of visitors coming home in comparison to your size of the house. Make sure these people who are coming are as finicky as you are, because you're asking this question. So they don't go out. They are not flying all around the city and partying all night. Make sure they're as careful as you are. And try to keep a distance. I understand they're coming for dinner. I can't tell them to have their masks on and have their alcohol and eat their food. But at least keep a distance between the 4 or 5 or 6 of you all.
Now, the next question is, I guess, a question which a lot of people want to ask, but they may not have always asked. Can one consume alcohol after vaccination? And after jab 1, after jab 2, and what is the duration? And before the jab? I want to ask this question also.
Unparliamentary question, unethical question, especially to a doctor. But data right in the beginning, I know where this is again coming from. Data said that you can't have alcohol for 45 days after your jab. And you know where this 45 days number came from? Because 45 days is 2 weeks after your second shot if you take the first and second shot 4 weeks apart. So it typically fits into that. There is no data to say that you can't drink alcohol. But alcohol overall hampers your immune system on the long run if you have large bouts of alcohol. So I don't see a contraindication to alcohol, but I see no reason to binge on alcohol, especially on the days, 2 or 3 days before and after you've taken your vaccine.
Right. Okay, a counter question. Alcohol is equal to beer, or, could you define alcohol?
Yes, alcohol is any drink which is allowed for people above 21 years of age. So whether it's beer or whiskey, and now they've reduced 25 to 21. So whether it's whiskey, beer, gin, rum, wine, or what may, it's alcohol. It's the percentage that differs, but it's ethanol, it's alcohol. So it refers to that. You may want to have one small drink of a white alcohol and have 4 points of beer. It makes no sense.
Thanks, I've noted that for sure. We have a question from Narayani, who says, is there a possibility of a stroke given that one has a family history of strokes?
Yes, Ms. Narayani, I have answered this partially, that there is no relationship to thrombosis post-vaccination. However, if you are urging me to answer a little more, if you these incidences of cerebral venous thrombosis relates to veins of the brain. So if you've had a history of venous thrombosis, or if you have deficiencies of a particular kind, and that I'm not going to tell you because half of you all will go and run to that test, and which is not important, then you may need to be careful. But if you've had arterial stroke, that means a stroke or an infarct, or we call a bleed, there's no relationship. It's not a contraindication.
Right. We have a question from Kalpana Giri. Says, high protein in the blood is more dangerous to catch COVID. Is that true?
High protein in the blood, I think she means C-reactive protein and not protein, CRP. So CRP, as we said, is an inflammatory marker. It does not mean that you have higher incidence. It means you have some inflammation infection.
Now, there is a question from Mr. Makaram Radhakrishnan, who says, I'm 65, took the Covishield first jab on 5th March, did not have any side effect, no fever, body ache, swelling. I was drowsy for 2 days, that's all. Is the vaccine going to work? And there are a few more questions which I asked you questions like this.
The vaccine will work. I cannot tell you what is the protection or efficacy that it will work. It's supposed to be working at an efficacy of 80% after 2 doses. Your drowsiness does not seem to be related to the vaccine directly, unless you have taken some medication that has caused some drowsiness, or just fatigue could mean that you're lying in bed, not directly drowsiness. So you will have protection after the first dose, 55%, after the second dose, more than 80%.
We have a question from Bridge Dugal, who says, I've taken the first shot. I was going through a denture placement and my dentist has held back the process because of the surge. What should I do?
Find a new dentist. So if the dentist is not, if it's, and I don't blame him at all, if he is not ready to work on you and you need the dentures urgently, which I'm sure you do, you will have to find some other one or some other place where they can do the job for you.
Okay, thanks. There's a question from Jashwant Kamdar, who says, I'm 87, having BP and twice had an angioplasty. I have severe pain and need dental treatment. I've taken 1 shot of Covishield on 15th. Can I take an antibiotic and painkiller?
Yes, if you have taken your shot, you can take an antibiotic and painkiller. At that age, and generally, I would advise you not to take painkillers such as ibuprofen, commonly available as Combiflam. Paracetamol is the one that's safest and easiest to use.
So no Combiflam, but only paracetamol.
Combiflam in general is a stronger painkiller, but it has side effects, gastric side effects, so nausea, acidity, and can affect the kidneys also. So I would be careful in using Combiflam, ibuprofen, diclofenac. I don't want to take brand names here. I would rather stick to a paracetamol for any pain.
Right. Somebody has asked, I have fibromyalgia and polymalgia. How safe is it to get vaccinated? Are there any precautions to be taken?
I think you are one of the two. Either you have polymyalgia rheumatica or fibromyalgia. You're a good candidate to take it, provided you're eligible to take
it. Somebody who said, my aunt is bedridden with severe case of rheumatoid arthritis. She's already had a case of COVID. Is it safe for her to take a vaccination?
Good question. So I've been urging with the authorities to start door-to-door vaccination, especially for these elderly population or people who are bedridden. You had someone of stroke. It's impossible to get that person of stroke to the center to get vaccinated. So I think the government is working to it. Rajasthan has started doing door-to-door vaccination very interestingly, and that I think is great. But for this person, it is safe to take the vaccine, even if you've had COVID-19 in the past.
Thank you. We are almost at 6 o'clock and the questions haven't ended, but I'm going to just ask a couple. One is from Sunil Maru. He says, I had COVID in October 2020 and was under your treatment at Beach Candy. I had a bypass 7 grafts in 20 years ago. I took the Covishield vaccine on 12th March. Should I take the second dose? If yes, after how many weeks? He should be contacting you directly, but anyway,
no, that's fine. Mr. Maru, go ahead. You had your COVID in October, so you're almost 5 months down the line. You must take your second shot, and you may take it as early as 12th April onwards anytime. But your response of your first shot will be better than anyone who's not had COVID in the past. So you've already got a secondary immune response, which I was explaining right in the beginning of the show, but it's good to take the second shot because your immune response will fade over time. So the immunity that you have developed because of the infection will fade over, but your T cells or your army men will be active for any future infection.
Right. We have a question from Bhavna Khatri, who says, I'm on tamoxifen since 8 years and my platelets are historically high, between 500 and 600. Am I at a risk by taking Covishield or Covaxin? Which one should I take?
So 500 to 600 is mildly elevated platelets. You are referring, so high platelets, not at a level of 500 and 600, are thrombotic in nature, especially. So if you have high platelets, you have a higher chance of getting a stroke or thrombosis. And this relates to people who have chronically high platelets. I don't want people calling me tomorrow that yesterday I had an infection and today my platelets are 520,000. It'll come back to normal in 3 weeks. But this person says she has chronically high platelets. I don't think 500 and 600,000, you're at a risk of getting stroke. Make sure you're adequately hydrated to prevent cerebral venous thrombosis.
There's another question that has come in is, Doctor, I've taken my first jab, but in the last 1.5 weeks, I've had severe cold and cough. And my second jab turn is coming in now. What should I do?
If you've had COVID vaccines, even if you had 2 vaccines, you can still get COVID-19. So make sure you don't have COVID-19 at this moment. If you're suffering from COVID-19, you have to defer or postpone your second shot. If you're suffering from any other acute viral infection, defer your second shot to about 2 weeks after you finish your illness.
There's somebody who had asked this question earlier about taking an Rtpcr. How fast after I need to travel? Is it possible for me to take an Rtpcr a few days after the jab?
So I'm going to reframe this question, Mr. Maheshwari. The question is, will I get an Rtpcr positive after getting vaccinated? No, these are inactivated viruses. These are not live viruses. You will not get an Rtpcr positive in lieu or virtue of getting vaccinated. So you can take your Rtpcr in the next 10 minutes of your vaccination after you are let out of that 40 minutes waiting there.
And you could well be testing positive after that also.
You could test positive if you are a carrier, if you're suffering from COVID-19, but it's not related to your vaccine.
Doctor, we have several questions that have come in. We've answered 22. There are still some 38 questions which are open and some questions that have come in, but most of them are similar. And I think you've answered a fair number. Just one last bit, something that Vishal Sampath has asked about the new strain and variants that are emerging. Are vaccines able to fight those two? And as gloomy as it may sound, does it mean that we will be discovering new variants and trying to keep up with uncertainties in the future?
I think that's a nice closing question. So it's called survival of the fittest. When the drugs become more powerful than the bugs will find another way. They'll find another environment. They'll find a different shape. They'll find different structures. So this is called mutation. The viruses are known to mutate. Bacteria are known to mutate. And this virus has certainly mutated. We found several mutations in our country too. Now, if you recollect, and if you've been listening to me, I spoke about the healthcare worker study in the UK. Now, they have found that this protection that they took after the Oxford vaccine did protect you, especially from the UK and the Brazilian strain, but there is no data to say at this moment that it protected you from the South African strain. Now, your next immediate question to your mind will be, how do I know what strain I've got? Well, no one knows what strain you've got. It has to go to the National Institute of Virology if you're in India. It doesn't matter. So as mutations occur, there may be a drop in efficacy and there may be a reasonable small percentage of people wherein the vaccine will not be effective. The companies, the medical research are already working on a vaccine which is called a self-amplifying RNA vaccine, which is a younger brother or an elder sister of the vaccines that are available today. And I see this light at the end of the tunnel pretty close. So we will find self-amplifying RNA protein-based vaccines, and we will be able to fight the mutant vaccines, the mutations of the virus in the near future. But they may mutate later. We will answer that when we come to that.
Doctor, I thought that would be my last question, but there's a question which I think is important to ask. So Shruti Gada, who's saying, is a blood cancer patient a safe candidate to take the vaccination?
Yes, Shruti, a blood cancer patient is safe to take the vaccination. The only thing that I told you, a little caveat that the Moderna and the Pfizer wrote, that if you were on rituximab, you should wait for 2 weeks to 4 weeks before you take the shot. But if you are on any other chemotherapy, it's now advocated that you must take the vaccine. And then I would go one step ahead again in this also to say that if you are there for an elective surgery, now we have data to say all across the world, it's better to get vaccinated. And the chance of getting COVID-19 after a surgery, just because of interaction of people and visitors, is much less if you have been vaccinated. So go ahead and get the person vaccinated.
Doctor, the next question, you'll possibly laugh at it, but it's a fact, and that kind of indicates what the sentiments are. Doctor, if you had a choice, which vaccine would you take? Covishield or Covaxin?
So I have very categorically and openly said that I've taken 2 shots of Covishield, and I probably am protected at this moment of time, and I need to keep my behavior at complete discipline to remain protective further. If my antibodies do fade away, or if you have data and I may not do my test to say that 6 months later you need a booster, I would probably shift to another variety of a vaccine, and probably Covaxin or the inactivated one would be my next choice. So that I target multiple sites of the virus.
Thank you very much, Doctor. And I think we must have you once again, perhaps after a few months, because there will be fresh questions that we'll have there. We will be more aware of more findings and research, data coming in. So thank you once again for spending your time this Saturday evening. And to all of you here, we've had quite a few people who have registered. There have been quite a few people who have attended this session, as well as on Facebook. Thank you all for being there. We will be back once again next Saturday for another session of Health Live at Seniors Today. Thank you once again, Dr. Samdani, for your time.
Thank you, Seniors team, and thank you, Mr. Maheshwari. You had a tougher job than I had to choose the correct question. And thank you for this august audience. Pleasure being here.
Thank you. Thank you.
Thank you.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here once again Dr. Pratit Samdani. And Dr. Samdani, as you are aware, will answer questions on the COVID vaccine, the need to take the vaccine, space between the first and second dose, the aftercare, and all the questions that you may have wanted to ask. A little about Dr. Samdani. He is an award-winning doctor with specialization in internal medicine. He has experience in general medicine, emergency, casualty, HIV, isotope, diabetes, nephrology, neurology, infectious diseases, and OPD. He has vast experience in training and teaching graduate and postgraduate students. He is an honorary professor of medicine and head of medicine unit at the GT and Sir JJ Hospitals in Mumbai. He's a consulting physician, intensivist, and head of the Department of Intensive Care at the Beach Candy Hospital. He's also a consultant physician at the Jaslok, Saifee and Bhatia Hospitals in Mumbai. Welcome to Health Live, Dr. Samdani.